Hi everyone, welcome to Protean Pulse, a healthcare podcast from Protean Med. I'm Raji Hari, President and CEO of Protean Med, a healthcare staffing and recruiting firm based out of the Woodlands, Texas. Today we have the privilege of chatting with a veteran physician recruiter with over 6 years experience as an outside recruiter and 15 years as an in-house recruiter. He's currently the enterprise director of physician and APP recruitment for Jefferson Health in Philadelphia. Jefferson Health is an 18 hospital system in Pennsylvania and in New Jersey. And he's also a member of the AAPPR since 2008. And he has served as co chair of the fellowship committee in 2015 and has contributed articles, and he has given many speeches. And he's one of the most sought out speaker for some of the conferences that I've been to. And Steve has also served as the president of the Mid Atlantic Physician Recruiters Alliance since 2019. So he's got pretty great credentials to his feathers on his cap. So welcome to the podcast, Mr. Jacobs.
Thanks for having me, Raji. It's nice to be here.
Thank you. Let's start by hearing a little bit about your journey. What got you into physician recruitment, where it all started?
The journey was really happenstance. I was a preschool director before I became a recruiter. Seems like 100 years ago. I did it primarily because I had a daughter at the time who needed help, needed care. And so I got to bring it to work with me, for 3 years. And then it kind of ran its course, and I was in the middle of looking for, for something else. And I definitely, in my upbringing, in my childhood, I had a love for medicine. It wasn't in the cards for me, but I happened on, I think they actually reached out to me and worked for a large search firm that talked to physicians every day and tried to find them jobs. And I thought that was interesting. And I went through, my training. Turned out I was pretty good at it. I do come from a long line of family salesmen, and certainly recruiting is a sales job if it's not anything else. So, it kind of found me, and then I really liked the way my brain and my mind, and that I got to, hang out with some pretty cool folks.
Interesting. So what are the challenges that you have faced in your transition into this industry?
I think the biggest hurdle was knowledge. Trying to understand what everybody did, what's the difference between a nephrologist and a hepatologist, and, all of that kind of stuff. That was the kind of the first issue that I had, although I did have, some basic understanding of medicine. And then I think it was, really trying to figure out the market, okay, what am I getting myself into? How does this work? How many competitors are there? Who are we competing with, for the doctors and for the jobs, and what do my clients look like? And then, it turns out it's one-man shops, it's clinics, it's hospitals, one hospital, it's a system hospital, all of those kinds of things. We're definitely, part of the learning curve, trying to understand, okay, yeah, I'm selling the job of a pediatrician, but what does that look like on the other end? And I'm kind of naturally inquisitive. So it was like, okay, I'm going to go find out. I'm going to go to the hospital, walk around and walk into radiology and look at their machines and see what they do. And so I quickly realized that the more knowledge I had, the better I was at what I did. So that started me on my journey of just devouring as much information as I could find, from that standpoint. Nobody goes to school to be a physician recruiter. Nobody. So
That's true.
you either have a penchant for it and you have an acumen for it, or it doesn't work. It's not for you. You can't do it.
I'm in the same boat. So I come from healthcare scientific research background. Then I went into IT research. IT recruiting, I would say.
Right.
And from recruiting and staffing, I've moved into healthcare. So it's a lot of learning curve and things that I am figuring out as we move forward, right? But that's the
Yeah.
challenge and the interesting aspect of life as is. So that's interesting. You moved from being preschool director into healthcare, right? So
Right.
how did you come about to become this executive position that you're holding right now?
So it turns out that practices and selling practices and jobs and selling spots in a preschool are not that far apart, right? I still have to convince somebody that it's a good idea, and I have to do that by understanding what I'm selling. From that standpoint. So I also realized after 6 years that the outside firm business was not for me. It was too cutthroat. It didn't have enough, touchy-feely stuff for me. I didn't feel at home. I could sell the practices and send people to Oregon and Wyoming and Mississippi and, all those people, but I never saw them again, and it just didn't work. So when I went in-house, it was because a client of mine said, we want to build an in-house recruitment department. We don't have one. And I thought, okay, here's my chance. I've got 6 years under my belt. I can take most of what I know and I can apply it and build a program. And I did. And I've done that a couple of different times in my career. And so by doing that, I felt like I had a little bit more, power than your average recruiter coming into a program that was already there. I was building it and flying it and building it and flying it, and doing it from the ground up. And so those were the initial building blocks for me. I knew I always wanted to be, once I got on the in-house side, I knew I always wanted to be a director. I wanted to move up the ladder. I already had a master's degree, but I wasn't going to go back and get an MHA or an MBA. I was sick of school and didn't want to go, through that. But I knew that there was opportunity. The first job that I had where I was building the program really turned out to be me being a director. I mean, I didn't have the title, but it was me. I was a one-man shop, doing all the bits and pieces. And that program is still in place today. The person who actually runs it was my assistant at the time. So that's, it shows you that things can last the test of time,
Absolutely.
From that standpoint. And now she's taken it, she put her own stamp on it, and she's doing her thing. But I think, that drive of always trying to be available to give information to the higher ups, to the leadership, the C-suite, knowing what was going on, being able to, answer difficult questions, being able to help build bridges that weren't there already and that we didn't have, put me into places where the opportunities were going to arise. And so what happened was I ended up in a hospital that became part of a merger, that became part of a bigger merger, and then I was fed up with the merger process and I went to another hospital system and then they merged. So I wasn't going to get away from it.
Yeah, we're seeing a lot of it now. I mean, turnaround, there is like mergers and acquisitions left, right, and center. So we're going to see more of this, I guess, in the future as well. Right?
We've done 4 here at Jefferson and we're on our 5th. So
how do you think this landscape in healthcare recruiting has changed over the years? Now that I've been listening to your story of how you built the entire setup, the recruiting engine, and then it gets sold and things change and new technology has evolved. You've got the vendor management systems coming in. You've got new softwares that are coming in. You've got the AI that's coming into play more and more these days. So how has this landscape changed over the years and how did you feel it has benefited the system?
Yeah, I think that the biggest change is the physician shortage. That is something that kind of underlies everything, that we do. I can't make urologists and I can't make neurologists. They move around and we have to find them and I have to have my ads up and everything and doing, what needs to be done. But in the end, they have 50 options and they can only go on so many interviews. And so you're trying to put your best foot forward. So that's changed because we know that in certain specialties, it's just kind of empty, in terms of you have to wait or take a newbie right out of residency or fellowship. And that's not always what we want to do, and so we have that issue. What I think is happening now is technology is taking over. And I think it's a good thing because depending on the size of your organization, you need more and more technology. We just went to a VMS system for our locums. I have 18 hospitals. We are probably going to have 30 by the time the end of the year comes around. I can't manage locums for 18 hospitals. So we did a VMS. It's working out really well and I'm very happy with it. We're going to Workday, whether you like it or not, ATSs are around for a reason. But to be honest with you and the audience, if they are physician recruiters, none of the ATSs work for us. They don't capture the right information. I can't figure out what's going on. We need business intelligence, which is why we have Click, which is our software intelligence that allows us to go in and pick out the things that we need and filter out, and get spreadsheets and those kinds of things. So those things are happening. I mean, the landscape of medicine is changing. Telehealth, digitizing, appointment making and digitizing going to the doctor. And we're opening a new tower that's incredibly digitized for patients who know how to use that technology. And it will help them, along the lines. I just learned that we don't give out disclosure notices now for HIPAA. It's on a screen in the center and you can QR code it if you want to take it home with you, and which is brilliant, right? We can save paper and, as long as people know how to use their phones, they can use the QR code. So those things are happening. And I think we're going to have, much more in the primary care market. People are going to start having wearables and things that they're going to wear on them that their doctor can see on Zoom. And then they can measure, pulse ox and their heart rate and all those kinds of things. And I think that's going to be, fantastic. AI, as much as I love it, also scares me, a little bit, just in case, in respect of its size and power. But we are using it and we are using it very effectively. And the one area that we're using it the most is in writing job descriptions. So if you tell AI, I want a job description for a total joints orthopedic surgeon, in 10 seconds, 90% of it is accurate, in terms of what I need as a base that I don't have to come up with. And I can put the Jefferson spin on it and the flavor and add the little bits and pieces that I need to add. So it's taken a lot away from my recruiters in terms of having to come up with ads, on a regular basis. And then the last thing I'll say, one of the things that's become really, really helpful to me is the idea of doing a job scrape. So with the New England Journal of Medicine, we do a job scrape. They scrape our job site for physician jobs and APPs on twice a day. It goes up on the New England Journal of Medicine, and we have probably increased our applicant volume probably 40%.
Wow. Okay.
If not 50. I mean, they just keep coming in, from all over. So that technology has then allowed me not to have to then hang a shingle every time I need to do something. And now we've done that with Doc Cafe. We're in the process of doing it with Practice Match. So some of our bigger, vendors that we use will now be able to scrape our site, and I don't have to worry about it. Once it goes up, and once we fill it, it comes down.
Really?
So makes it nice.
That's interesting. So how do you think this is going to shape the future of physician recruitment? Because right now we still have a lot of, coming from the IT side of things, I see that physician recruiting or APP recruiting is a little bit, it's not cohesive, I would say.
Right.
It's very fragmented. It's got a lot of places where it can definitely improve. Right.
Yeah.
In IT, we've got just one place where we can, one or two places probably where we can go look for the correct candidate. We can source them. We can talk to them, everything. Here, it's not like that. You've got multiple database that we need to source from. Where do you see this is going to go? What changes do you foresee coming up in the future in the recruitment space?
So I think, for a lot of the health systems themselves, especially a health system like Jefferson, where we train like 1,100 residents and fellows, every year. I think what's going to happen is that we're going to see a couple of things on the front line. One is what we're going to see a lot more attention being paid to getting those residents and fellows to take jobs at Jefferson. Right now, we retain about 16% of the kids that we train, which is terrible. So we have plans to be able to work that. And then also in terms of that candidate pool, it's also a candidate pool for moonlighting. And so in order for it to be able to offset some of your locums needs and your stuff like that, you can use some of your third years and your fellows and those kinds of things to do hospitalist work and to do other things if they want to pick up shifts and get paid for it. I think the technology itself, what I've noticed recently is almost the same as the hospitals, these mergers and acquisitions and people saying, well, I'm doing one thing, the Journal of the American Medical Association is doing another. Why don't we do something together? If you post on my job, then it posts on JAMA. If I post on this, then it posts on that. So we see a lot of that happening with people trying to get more people on the database. The companies are trying really hard to make sure that they're relevant and that people are getting what they pay for, from that standpoint. So Healthy Careers recently did that with JAMA. So you post on Healthy Careers, you end up on JAMA for free. Great. I love it. Bundle it, those kinds of things. So I think those things will continue to happen. The big thing that's always been an issue for me that I hope they can solve is your membership has, all of the society pages and all the society career centers and things like that. And it's still, to your point, very clunky, very one-to-one. You can buy credits, but then, the credits go quickly and it costs a fortune and people's budgets, people freak out, all those kinds of things. So I think it would be nice to see somebody sort that out. Right now it just feels like it's like an octopus with 300 arms, and every one of them just keeps saying, give me money, give me money, give me money. Society for Oncology, the whatever it is, ACR, and everybody's going, give me $600, give me $400, whatever it is, and your advertising budget goes out the window. So I think what we're trying to do is consolidate. What we have to do when we're asked to do more with less is we have to be able to bundle things together, and we have to be able to do things like the scrape that I can say to my recruiters, don't worry about hanging that up. It's going to be done automatically now. You can do something else, because to your point, we are fragmented in the things that we do. We're doing administrative stuff. We're doing some sourcing. We're talking to doctors. We're helping the departments. We're doing credentialing. We're doing onboarding. All of that happens, in any cycle of any day in any recruiter's life. So anytime we can shorten that, anytime we can make it so that I don't need 47 approvals, and we start looking at it from the standpoint of a Six Sigma type of analysis, and then we start pulling pieces out that we don't need, to make it shorter. And we also know from as being recruiters that time kills all deals, and we need to move quickly and expeditiously. We don't want to make mistakes, but at the same time, people have options, and if you don't get your act together, they'll take another job somewhere else.
Right, absolutely. I mean, as you said, we keep spending money for advertising or even for those databases, and it quickly adds up. We are paying for every little thing in healthcare, and finally the revenue is not enough to, especially for small businesses like us, it really hurts us and burns our fingers. So
Yeah.
I just hope we can all come up with some sort of a technology to consolidate and work together in a very, synchronized way, I would say.
Yeah.
So as the director of physician recruitment and APP recruitment in Jefferson Health, what exactly is your role? What is the responsibility that you carry, and how do you define your goal and your role in this organization?
So my role is to oversee all physician and APP recruitment for all 18 hospitals. And I sit on top of a team of 7, which is 5 physician recruiters and 2 APP recruiters who do all the heavy lifting. And then I recruit myself. I have about 35 jobs that I recruit for GI and for urology and physical medicine and rehabilitation. My goals with them are that we fill every job. I mean, that's the easy one. I can say that, we're going to fill every job. Last year, we did 678 hires for both physicians and APPs. This year, we're on track to do 800. And that's with the same team, so it shows you, one, how talented my team is and what it can do. And I have to be very careful to watch their burnout and watch the rec levels and the things that are going on. And then I have to fight with talent acquisition because they have 150 recs over on that side of TA, and my guys have 60, and they're like, well, what are they doing? And that's every one of their jobs is worth 2 of theirs. I'm constantly defending my team. I'm their biggest cheerleader, from that standpoint. And a lot of my job is fixing problems and explaining processes to people who are trying to hire, the right people and the right folks. On top of all of that, I do report for the entire organization on every recruit that's hired in every month. And then we look at that, by region. And then we have, I have reports where I look at time to fill, which I hate. It's the worst variable that you could possibly imagine for physician recruitment. I know that it works on the other side, but it doesn't work for us because we don't control the whole process. And so if it takes, 6 weeks to get a contract, that's not my team. My team's not doing, that's the contracting team. And so we look at the time to fill, and then we kind of laugh because it's, some of it says like 300 days or, 400 days or whatever it is. Or I have recs that have been open for 900 days, and people just laugh because it's like, it is what it is.
Yeah.
You
do have a long credentialing time also, right?
Yeah, we do. We have a 4-month credentialing time. We do look at our time to fill now from the time that the rec is open to the time that the person accepts the position and signs a contract. Then the onboarding piece, we don't add that, although I can look at it from like the full cycle. If I look at it from beginning to end, from the day they come in and the day they start, that's a little bit more skewed, because it doesn't follow a pattern, and people don't hit, like, oh, you have to have your application in 30 days, and then they have it in 40 days, so you're kind of constantly chasing people and things either inside or outside your organization. So I wear a lot of hats. I work on immigration for all of our candidates that are coming in on H-1Bs and J-1s. I really enjoy that. I have passion for immigration, having not been born in this country and having immigrated myself. I know how it works, and I know what it means, to be able to get in and get your green card and do all those kinds of things, because I've done it all. So those things are important to me, and I have, I come up with projects and things, and I represent Jefferson when I go to national conference, and when I speak, like you saw me speak, I always let people know where I work and what I do.
Right. I mean, that's one of the things that brought us together was your speech, especially on the physician burnout. Would you like to expand a little bit, considering the things that you do, the many hats that you wear, the number of positions that you have on your hand, and the number of recruiters that you have to fill those positions? I mean, I see a lot of stress associated, and I think that's an understatement, to be frank. So can you talk a little bit about the way that you mitigate this physician burnout, and how do you recognize, and how can you work around that? How can you help it?
Yeah, I mean, it's an intentional act. You can talk about it all you want, but if you don't do anything, it doesn't make any difference. The best thing that ever happened to me was I got to stay home after COVID, during COVID. And I'm in the office today, which is like once every, God knows, 6 weeks maybe. But for the most part, I'm at home. I have been for 4 years. And that has been very helpful to me in terms of being in my own environment and being comfortable in my own environment and being able to do silly things like go water my orchids or, go outside and throw the ball for the dog in like small increments for 10 minutes, take my mind off of what's going on, clear my head, get my thoughts back together, and then go tackle, whatever's next. I think it's been progress one step at a time. When I had my heart attack in December of 22, my 2 heart attacks, my whole life's reset, in terms of like what's important and what's not important. And I think, part of my giving my speech now is to remind people that there are other things in life that are important and that you cannot overlook them because they balance you. They balance your psyche. They balance your mentality about how you take on things. If you don't use your PTO, what are you doing? What are you doing to yourself? Kind of thing. And I think in my speech, I talk about best advice my boss ever gave me. She said, "Do you use your health insurance?" And I said, "Yes." And she goes, "Why?" "Because I want to be healthy." So, "Do you use your PTO?" "No." "Why?" "Because I don't. I just work." "Well, it's a benefit too. You should, you have to use it." So you have to take care of yourself. I talk a lot about finding a space at work that you can take 5-10 minutes for you to clear your head, put in your headphones, put a playlist together, listen to some music, watch some videos that you like that make you laugh and, that keep you positive, and put things around you that remind you to calm down, to stress, about certain things. The biggest thing I learned, from my heart attacks was I took 6 weeks off, and I'd never taken 6 weeks off in my entire life. And I came back and Jefferson was still standing. And that's when I realized that all the things that I do to try and get back to somebody in 2 seconds and write an email and jump up and down and stand on my head and all, it doesn't matter. In the real world, you do what you can do. You try to be helpful, try to do it in a positive way. But if you don't get back to somebody until the next day or the day after, it's okay. It works because I pin a lot of my things in my emails and then I go, "Oh my God, I forgot." And the other person forgot as well, because I'm not getting more emails to say, "What happened to that? What happened to that?"
Yeah, right.
I just email them back, "Did you get an answer, to this?" And they say, "Yeah," or "No, it wasn't a big deal," or, whatever it is. So I find that it takes care of itself and I don't have to manage, my inbox. I used to have my inbox, believe it or not, down to 0 every day. I'd either have something, I'd have rules where things were swept into boxes, or I would literally go through it. And now I have, I don't know, 8,000 emails in my email because it's all searchable. What's the point? I
Yeah,
mean,
yeah.
you realize that you're just chasing your tail and you're doing things that are
It's a
silly.
rat race. It's a rat race. Yeah.
Yeah.
Coming to the immigration part of it, that really intrigued my curiosity here. How does Jefferson Health handle immigration, and what percentage of your physician or APP is the visa holders? And what is your thought on that? How do you go about recruiting those people?
So, one of the things I realized early on in my career was that there's this untapped group of physicians that are in need of visas, mostly H1s and J1s, occasionally O1s. And I was intrigued. I'm like, well, what is an H1? What is a J? What do they need? That kind of stuff. And then I listened to a lawyer. We had a presentation at National Conference and he talked about it. I was just like fascinated. I'm like, why is nobody else doing this? Why are people not chasing down these doctors? These doctors go to Harvard and Yale, they go to all these great places. Some of them come from, medical schools that are the Harvards of their country. I said, these are smart people. These are bright people that they have come to the United States to train under their J, visa. And now they are getting off and they need help, to stay. In each of the places that I've ever been, we've always looked to see where the J's can go. And we're lucky here at Jefferson. I have 2 facilities that are J1 eligible, 2 hospitals that can do the J's. And then we can take H1Bs till the cows come home. I mean, I can do H1s all the time. And we did, not this year, but last year, we did 7 J1s out of the 30 that are available in the state. And these were not primary care. These were med oncs, these were neurologists, they were a radiologist, a maternal fetal medicine doctor, a rheumatologist, some of the hard to fill, areas where they come to us for 3 years, they're on their J, we put them on H, they get their green card, and most of them stay. And I'd say probably 20% in any given hospital is probably what we do from a visa standpoint, maybe a little bit less, a little bit more, depending on the year. We did 4 last year. I think we got them all. We're just waiting for 1 med-onc to come through. It's a fascinating process. And I've sat now on a couple of panels with immigration lawyers trying to tell them what it's like from my side, and what can help expedite it. We're always at the beck and call of the government and the processing times and the, all of that. But I find it to be incredibly valuable, to find these doctors and give them a home, and they're appreciative and they stay and they want to finish up whatever they're doing. And most of them, have been on the East Coast. They're training on the East Coast. They just didn't know where they could find a J.
Right.
But I think the other part of that, Raji, is that a lot of them don't know how it works. Like they're on the J
Exactly.
and they want the waiver, but they don't know the timelines, the deadlines, the paperwork, all the stuff that needs to happen. They just kind of they put their hands in the air and,
Fear of the unknown. Yeah.
I'll just tell them we have an attorney. Don't worry. We'll take care of it.
Exactly. Yeah. And I've been advising some of my clients too. I said, it's so much easier for you to get a J1. All you have to do is just get this done. But somehow, there is that resistance to getting that. So interesting. So I'm sure you've got a complex compliance and diversity and regulatory process in place, right? So can you tell us a little bit about those things that you handle, the complexities involved in it?
So Jefferson has a enterprise office of DEI, and we have initiatives with the university to make sure that our candidate pools for some of our professors' positions and associates and things like that meet criteria for making sure that we have people of color, we have women, we have LGBTQ, whatever it is, we try to accommodate as much of that as possible in the panels that we put together, for those particular searches. And those searches are nationwide, and we take anybody who fits the qualifications. And I think we are struggling like everybody else because there's not a lot of African American, for instance, physicians. It doesn't make up 50% of the medical students. It doesn't even make up 30% of the medical students. And then Latino and women. And so you start looking at that, and then you start to look at the diversity that you don't see in the MD world that you do see in the DO world, and you see people who've gone back to medicine after having a career as an architect or whatever it may be. But I think DEI it's a great construct, and I think we should always be aware of trying to have as much diversity as we possibly can. Probably 50% of our patients here in Philadelphia, maybe up to 70% of our patients here are African American, and they go from the highs to the lows in terms of healthcare and equity. So we have a lot of that, and we want our physicians to look like I want the population to see physicians that look like them, because it's important, from the standpoint of health and trust and being able to get people to go to the doctor. But I also think that it's at this particular moment, I think it's missing the mark because we haven't done the other side of it to push up the numbers of people that are coming out.
Yeah. So, I mean, this is mind-boggling, right? You've got a physician shortage. You've got, a shortage in terms of diversity and women in medicine. So, what is being done to get this up and going? I mean, they really have to do something drastic to fix this, right? Because the need is there, definitely.
Well, I think part of it is driven by money, and grants and things like that. And what needs to happen is that I think personally, I think there needs to be a huge investment in historical, Black colleges and universities, programs where people of color are going, to make it easier for them to get in and make it easier for them to become whatever it is they're going to become, a cardiologist, a urologist, or whatever it is. But it's a grassroots effort that starts in medical school. Right? If we've seen it in a couple of areas over the years where come to so-and-so school, get your tuition for free, right? And we've seen some of that happen. And I think that the same way that we have, worked on student loan forgiveness for college students and grad students and some physicians, I think there needs to be an emphasis on physicians paying way less to get to where we want them to be.
Right.
And it needs to be subsidized, in a way that they don't come out with $300,000 worth of debt.
Right. Absolutely.
Which is part of the anchor that holds them down, who may or may not have the means to go to medical school, going, okay, I don't want to be $300,000 in debt. Maybe I'll go do something else, kind of thing. So I think there's perceptions there that need to change, but I think we need to go to the source. Even if that's going to high school or the college, whatever it is, to say, if you come and work at Jefferson, we'll give you $250,000 towards your education, and you come and work with us for 5 years or 8 years, or whatever it is. But it would be complete quid pro quo, right? I'll give you something, you give me something in return. And
exactly,
open and transparent, and people would know, listen, you can come to Jefferson's Medical College and you can come and get your MD for free. I mean, if we did that, people would be, the doors would be like flying off the hinges.
Mhm.
So I
Yeah,
think that's where we're at in terms of how do we fund it. I think there's some grants and some things that we probably need Congress to help us do it, to be honest with you, but
absolutely.
I'm not going
Yeah.
to hold my breath about that.
Yeah. Coming back to the recruiting part of it, right? With the physician shortage, how much do you think social media plays a role in helping recruiters find the right candidate for the jobs?
So I think it can. I'll take LinkedIn, for instance. It's the easiest one, right? Because it's business oriented, and we see a lot of people who have big titles on
Mhm.
LinkedIn, right?
Mhm.
Not necessarily your individual one urologist, one oncologist, one nephrologist kind of thing. It's usually their name, and then we don't identify them as as medical doctors. But we can advertise, and we can put things out on LinkedIn and put jobs out there. And if people are open to it, the issue is that we don't control who's open to it and who's not open to it. And the same thing is with access to people on Facebook. You
Mhm.
don't you have to find all these people and group them together.
I don't know.
And there are moms, cardiology moms on Facebook, and
Mhm.
PMR moms on Facebook, and dads who, whatever. Then they're private groups. You're not going to like knock on the door and say, "Hey, I'm a recruiter. I'd like to talk to all of
Mhm.
you, ruin
Mhm.
your whole day," kind of
Mhm.
thing. So social media has its limits. And, it's great for advertising, but again, you're kind of waving a flag amongst a million flags, right? I mean,
Mhm.
there's only so many ways you can crack an egg.
Right,
If
right, right. And I also felt where the LinkedIn is concerned, not all doctors are on LinkedIn either.
no,
They are
no,
not, and
yeah.
they're like, "Oh, I'm not going to be on LinkedIn. No, I'm not on social media." I'm like, "How do we reach you?"
Well,
So,
yeah, I mean, and that's a function of the outside recruitment world, right? Because
mhm,
those doctors are inundated with 50 to 100, solicitations every day
mhm,
that go in the
mhm.
trash,
Right,
letters,
right.
jobs, hey, come work here, come work here, come work,
Mhm,
600 grand an hour or whatever, and people are like, what?
mhm,
That's ridiculous. But because they're hounded so much, they won't go out into the public sector
mhm,
of that social media
mhm.
because they don't want people in their feed.
They are sought after. Yeah.
Yeah, yeah. I mean, like I said, you can find professors and you can find chairs of departments and things like that on LinkedIn.
Mhm.
And eventually somebody reaches out to you, and then you use that to say, okay, who do you know that might be interested in this job? That's how you
Absolutely.
network that one,
Mhm.
from that standpoint. But social media as a line of defense or a line of inquiry is probably not the best place to.
Not working out. Yeah.
Yeah.
Coming to the partnership, right? There are two sides for any recruiter, for especially in-house recruiters like you. You've got one side, all the 18 hospitals that you're managing, the different departments, their directors asking you for full-time coverage, perm, maternity, locum, etc. And you will also have you said you also work with vendor partners, right? So tell me a little bit about the challenges in handling these partnerships as you kind of like a middleman there, right?
Yeah,
So,
yeah, yeah. And I'll tell you right now, it's the bane of my existence, and I'd rather not do it if I can help it. On the database side and the things you and I were talking about, that's easy. It's a
mhm,
sales rep, and I'm friends with all of them. I've been doing this for long enough that they all know me, and we see each other at conference and all that kind of stuff. The issue that I usually have is locums. Now that we've gone to the VMS, I've taken a lot of that headache out. The VMS has a centralized person that works for the vendor, and they take all the brunt of it. But before that, I took every invoice, every call, every complaint, every schedule, every profile of every job. I managed all of it, and I was pulling my hair out on a regular basis because invoices are going to the wrong people in the wrong places, and the job somebody doesn't show up, and suddenly I'm in charge of fixing it,
yeah.
and I don't want to be. It's not my job. So the VMS was a godsend in terms of putting that together. I knew it, I had to, because it was just literally one-on-one. Every
Hmm.
company that came in the door, I did their contract, I did the confirmation letters, we talked about clearing candidates and presenting. I did all of it, and I was like, this is insane, from that standpoint. So we talked earlier about technology, and VMS has definitely helped, for something our size. It's
Hmm.
been fantastic. It's really, I can get reports, I can look at my spend, I can see
Right.
everything that's happening all in one place, one portal,
Hmm.
and they have to figure it out on the other end. I don't have to touch them, I don't have to talk to them. I haven't talked to them in months. So it's been really helpful, from that standpoint. But if you're doing that on a regular basis, God bless you.
Absolutely.
I
Yeah.
I have friends who are, and I know
Yeah.
their pain.
So talking about, as a small business vendor myself, I'm one of those, small speck in the ocean.
Yeah.
How do you look at external vendors? How do you partnership with them? And what do you look for in those vendors?
So I think what I am most interested in is integrity, right? I mean, it's easy to make a buck and sell your product, and then you never remember me, you never think about it, you never do anything. And sales is always about touch, right? I call you, I follow up with you, I follow up with you again. I ask you how your kids are doing. I bring up some business. We talk about something else. I bring up some business, and it's like dating, right? And
Mhm.
you're trying to get to know each other. You're trying to figure out what your relationship's going to look like. But I think ultimately the ones that I don't do business with are the ones that show themselves very early. They're very standoffish. They don't have the business savvy to be able. They're young and they're trying. And sometimes I will tell them, hey, that's probably not the best way to talk to a customer, to try and help them out. But I think what you're looking for is you're looking for somebody who understands you as an organization.
Mhm.
And I don't mean just what they read on the internet, but what your pain points are, how they can help, those kinds of things. And then it's the put up or shut up, right? Either you can do the job or you can't. And I'm now at a place in my career where people come to me and say, oh, this person says they can do all of this and they can fill all of our jobs. And I'm like, no, not gonna happen,
At
and
this, yeah,
and
this
they're like,
market, yeah.
yeah. And they're like, let's just try it. Okay, we'll try it. I've got 2 contracts right now that have been sitting there for 6 months. They haven't produced one candidate,
Mhm.
and so that's on them, from that standpoint. If you want to sit there and do nothing, don't think that I'm going to give you any more business,
Right.
from that standpoint.
Mhm.
But I think you have to treat others the way you want to be treated. I think
Mhm.
you have to be smart. And I think your product needs to do what it says it does. It's not
Absolutely.
bait and switch, that you're not going to get, oh, well, yeah, doesn't do that anymore. It does this instead. No, that doesn't help me. I don't really want it to do that, or, hey, we can make it do that if you want us to switch it or change it or whatever. So those things are, I think, important
Mhm.
for people to understand. You'll get a feel for it the more you do it, how vendors decide if they're going to be long-term vendors
Mhm.
or if it's a quick buck. Yeah.
That's true. I mean, at the end of the day, it's trust, integrity, and the fire in the belly to perform. So
Yeah. Yeah.
if these three is not there, then it's no point in even reaching out to customers, right? So
No,
um,
absolutely.
yeah.
Absolutely.
So you have this extensive experience. You've literally dived into this healthcare recruiting, and you have swam across the ocean, I would say, to some almost there, and you have seen it all. You've faced a lot of challenges. What are the three top advice that you would like to give to any hospital recruiting team head, on what they can do or they cannot do?
Right. I mean, I think first and foremost is train your team, right? Don't assume that everybody knows what they're doing. And it doesn't have to be, formal, but it can be in such a way that you pick a specialty, you all talk about it, make sure people understand what it is. But at the same time, also the working mechanisms of the hospital, the department, how you build an ad, how you build rapport with your stakeholders. Training never stops. I mean, I still learn things every day that I didn't know, and I thought I knew it all, but I don't. What you want to do is make sure that you, like you said, you have created that fire
Mhm.
within you to be able to motivate your team to fill as many jobs as they can,
Mhm.
and to be able to keep an eye on when people are struggling, how
Mhm.
you can help, not do the job for them, but help them think their way through a
Mhm.
particular problem or a particular issue. I think you have to, realize that there's a lot of fun to be had recruiting, right?
It's a lot of fun. Yeah.
There's the relationships and the solving the problems and the final product and the guy signs a contract and all of that is,
It's an
why
adrenaline rush.
yeah. And and then you have to watch for the opposite of that, which is the person who's right there on the edge and doesn't sign a contract and you're like, oh, I thought we had them,
Yeah.
kind of thing. So it's always highs and lows with recruiting, from that standpoint. But I think those things are important, as well as getting to know your organization
Mhm.
inside and out. Get to know what it looks like to the patients, get to know what it looks like for you. and get to know what it looks like for leaders, from that standpoint. It will help you be able to, speak more eloquently about the jobs that you have. It'll allow you to weave stories and examples of why we're so great at what we do. If you know certain things. Otherwise, we're just a hospital that does cardiology like everybody else.
Right.
So you have to find the things that, that put you on the map, that do this, that do that, give you the opportunity to shine.
Interesting. I'm going to go into the fun part, the rapid fire.
Okay.
Coffee or tea?
Tea.
Favorite travel destination?
Tahiti.
Morning person or night owl?
I'd say morning person.
One book that has had a significant impact on your life?
Emotional Intelligence 2.0.
I love that book too. If you weren't a recruiter, what profession would you have chosen?
Pediatrician.
Oh, I like it. Favorite quote or mantra that inspires you?
It's on my LinkedIn page. Do or don't do. There is no try.
A skill or hobby you would like to learn in the future?
I'd like to be a better carpenter.
Oh, you are a carpenter already.
I like working with my hands and I like woodwork, but I'm not expert. I'm not there yet.
Beach vacation or mountain getaway?
Beach.
Any hidden talents or unusual skills?
I'm a scuba diver.
Okay. No wonder you like Tahiti, right? Your go-to comfort food?
Oh wow. Something I'm not supposed to eat. Entenmann's chocolate donuts.
Dogs or cats?
Dogs.
If you could have dinner with any historical figure, who would it be?
Probably, it's a toss-up between Gandhi and Martin Luther King.
Nice. What's one thing on your bucket list you haven't crossed off yet?
Going to Japan.
That's easy. It's not. I love this rapid fire part because I get to really know my guest here. Any concluding remarks for our audience today?
No, this has been great. I mean, just to keep plugging away, keep finding ways to inspire yourself and, keep remembering that there's fun to be had in recruitment.
Thank you. Thanks for listening, everyone. Don't forget to subscribe to Protean Pulse. We are on Spotify as well. You can search for Protean Pulse and remember to leave us your feedback. I'll see you in the next episode. Thank you, Steve, for joining us. Don't miss the beat.